Welcome to the Matriarch Podcast, a sisterhood of legendary Black queens in the making, speaking about real issues, questions, thoughts, ideas, lessons, and cultivating future experiences. So let's get our crowns, wine, slippers, and start the conversation. In this episode on the Matriarch Podcast, we talk with Dr. Alana J. Arnold. She is a pediatric emergency clinician that leads with passion. Dr. Arnold wants to bridge the gap between culture and healthcare. She's doing this with parent partners. Pediatric emergency medicine is near and dear to Dr. Alana J. Arnold. She is a network director for pediatric emergency medicine services for St. Luke's University Health Network. Dr. Arnold is committed to revolutionizing children's healthcare by prioritizing parental support. With her guided healthcare app, Parent Partners, she comprehends the health needs of children and assists parents in navigating the healthcare landscape from birth to adolescence, fostering a sense of community and beyond. We hope you enjoy this episode and it's able to help you and your children. So here today with us, we have Dr. Alana Arnold, MD and MBA. So she knows the business side of things as well, which is always a bonus. But yeah, so talk to us about what it is to be a pediatric emergency medicine consultant right now.
Yes, so pediatric emergency medicine is a very interesting field. To give a bit of background, obviously most people know what a pediatrician is. It's someone who's a physician who takes care of anyone from birth on up to typically about 18 years old. Some of the college students try to linger around and keep being seen once they're over 18, but that's another story. And so emergency medicine sees everything, right? If you think about when you go to the ER, you're seen by a clinician, but pediatric emergency medicine focuses on children in that space. So you might go to a children's hospital, for example, where they have their own ER. You would see me there. Or I could be working in the community like a lot of my colleagues. I'm working in an adult hospital that just has a pediatric ER area. And the reason why I have kind of turned to consulting as part of the work that I do is that the vast majority of children are seen in community hospitals, ERs, urgent cares that aren't attached to a children's hospital. If you think about the layout in the US, there's about 6,000 hospitals. And only 5% of those are dedicated children's hospitals. That means that all the others are just general adult hospitals where children will still go, but not be at a specific children's hospital. And so that really started me focusing in on how can I better serve the kids that are seen in the community outside of children's hospitals that don't have the specific expertise of someone who's done training like I have. Pediatric residency after you finish medical school is 3 years. And then to do pediatric emergency medicine, you do what we call it is a fellowship, which is 3 more years of training, specialized in dealing with ER settings. So medical emergencies, how to do lacerations, splinting if someone breaks something, all these types of procedures, as well as medical care. And so when I started working in different arenas outside of an academic center, outside of a children's hospital, I found that there was a care gap. The adult doctors are great clinicians, and unfortunately, very often they're set up to fail. That's kind of how I phrase it, because it's not that they're incompetent, it's that they don't have the oversight and structure of a children's hospital. So they don't have someone making sure they have proper equipment. Children come in all different sizes. There's no one who's vetting the equipment to make sure not only that they have it, but it's functional and tested, and people know where it's located. So many times, you get a critical child comes in and people are nervous, they're scrambling, and they don't know where a specific airway device is or piece of equipment that's going to really save that child's life because there hasn't been oversight, someone who knows pediatrics who's been helping the team. And so my work really focuses on bridging that education, that clinical care gap for the adult ER providers who are giving the best care they can, and also making them kind of augment or level up their skill set because they don't have the specified training that I had the benefit of having for 3 extra years of fellowship training.
Yes, and we are so very thankful that I know you're not here with us in North Carolina, but any way that you can impact our community and get the children care that they need. I mean, my goodness, it's just, we need more. So thank
Absolutely.
you. Also, I'm so glad you brought this up because this was a part of one of the questions that I had, which was the clinical care gap, right? So to your point, there's 5% of hospitals that are dedicated to children. Even still, if you're taking your child to emergency care where you're already in a panic as a parent, and then
Mhm.
you're saying, hey, can you care for my child? Can you talk to us a little bit more about what that clinical care gap is? What can we as parents do to better prepare ourselves? And I know if you're a part of the Black Queens discussion, you may have already heard about this, but I think it's so, so important to echo and reiterate some of the
Yeah.
things that we do to advocate for our children as parents.
Yes, absolutely. So that's critically important because, especially depending on the age of your child, the parent is really the advocate for the child, and you have to come equipped really to the ER to make sure you get the best care. So, about 85% of children, when they're ill, it's normal. The parents go to the nearest facility. And given that discrepancy in children's hospitals versus non children's hospitals, 90% of the time, unless you're in like a huge metropolitan hub or something like that, you're going to go to an adult hospital or freestanding ER, freestanding urgent care. Those clinicians, again, it's not a matter of competency, it's just a matter of training and familiarity. And so, those clinicians, if you think about average ER doctor, may have 10 to 15% of their residency focused on kids. And that depends if they've been at a facility with the children's hospital attached or if it's just been freestanding and they're going through their pediatric rotations. So, particularly very ill children, it's not uncommon that they're going to have some trouble dealing with them. So, as a parent, some of the things that you can be prepared to talk about are what are the medical issues that your child has? Any chronic medical issues is really important to explain to the medical care team as soon as possible, especially if you're concerned that your child's very sick. The second thing is making sure that you know your medications for your child and the dosing and when they last had it. That's really important information. Another thing you want to make sure of is if you are in a setting where it's not a children's hospital, you want to talk to the whole care team and ask, are there pediatricians on staff? Are there any pediatric emergency medicine doctors on staff like myself with the fellowship training? And if not, then it's kind of a two-way street where you can kind of put the clinicians on notice that, you're savvy enough to know the difference between children's hospitals and non, and that typically they will be as thorough as possible and try to assuage any concerns or fears you may have if there aren't any pediatric specialists on site. So those are kind of the major things that you want to think about when you're heading to the ER so that you can communicate that with the care team.
I love that. Thank you for arming us with what we need when we go to the ER. And a lot of people may know my story, but for those of our listeners that don't, I unfortunately, but God saw us through, had a child diagnosed with neuroblastoma at 3.5 months of age. And so going to the ER kind of was a regular thing, even though we
Mhm.
were partnered with a child care facility, that's not necessarily the flow of going to the ER. And so I think it's really, really important that you know those things, how to get triage, how to get in faster. Luckily, we
Mhm.
were blessed to have a team that we worked with. We called them first, and then we went through the ER. And they were, by the time we even got there, they either were working on getting a space for us or had one that was available, and they just had to get us through triage and all of the updated vitals. So,
Mhm.
thank you for saying that. So, speaking of which, parents advocating, tell us how you got to Parent Partners. Tell us why you thought this was a tool, and it is a great tool for parents. But just tell us a little bit about your journey to Parent Partners.
Yeah, so it's been an interesting journey because I feel that it's kind of been a long time coming, and just the last few years, I've been able to see it to fruition. So, Parent Partners really focuses on building our health literacy in our communities for parents and families. I'll just go through a few issues that our families often face. Access is a huge, huge issue, as we've alluded to. The state of medical care is honestly in crisis because there's a shortage of healthcare workers, and pediatrics, especially pediatric specialists, is no different, if not even worse. I could go on and on about factors that contribute to that, but part of it is that the training is very long. So, for example, my fellowship was 3 years. If you look at my adult ER colleagues, their fellowships are only 1 year, maybe 2 years, or especially for like adult medicine. So adult doctor who wants to do cardiology is just one more year of training. So having 3 years of extra training when you're already an adult, you might have a spouse, you might have kids, all of those things will often deter people unless they're extremely passionate about it, because it's 3 years of you earning a very, very low wage while you're an adult. A lot of people, I'll be the first to say, yes, physicians make six figures, but it's a whole range of six figures. And depending on your financial situation, for some people, they say, hey, it doesn't make sense for me to do 3 more years of training and earn 40K a year while I got two kids, and I have to start paying back loans and all of that. So the length of training is really a deterrent as well. And so all these factors, reimbursement, et cetera, pediatrics gets reimbursed much less than adult medicine. Like I said, I could go on and on. And these factors have us come to a crisis where there are fewer and fewer specialists because it takes so long to train us and less people are going into the field. And so when you're a family, access is critical because with kids, anything can happen at any time. They can get into something, they can get an injury, et cetera. So access to appropriate pediatric care is a really big issue. The second component is insurance. As you know, like a lot of the population is underinsured or uninsured, and that is a hindrance for them to seeking medical care as well. And then the third component is that even those who are insured, given the access issues, it can be a very long time for you to see a pediatrician and even longer to see a pediatric subspecialist because of the things I just mentioned. And so all of these factors come into play where they come to me in the ER. So I was seeing tons and tons of families that had great health literacy, but for some reason couldn't get access to the pediatrician or the pediatric specialist because of super long wait times, or those who are underinsured or uninsured who are using the ER as a one-stop shop for, a pediatric visit, a well child visit, sports physicals, all of those types of general pediatric things. And so Parent Partners really bridges that gap. Our app focuses on allowing parents and families to have access to vetted medical expert content. So you have access to a team of pediatricians and other health experts who go through tons of topics that are high yield. We have programming on asthma. We have programming that we just launched on back to school, where we talk about sleep hygiene, how to engage with your child to make sure school is going well, bullying, mental health issues. We have an obesity program. We have tons and tons of content that allows the family to, with just their smartphone, connect with vetted medical information without having to troll TikTok and get misinformation. And so really our goal is to bridge that gap and build community as well for like-minded families to get support, because a lot of people, you mentioned your own story, like it can be very isolating sometimes if your child has a medical condition and just very stressful, right? Having to do many visits to the ER, admissions or procedures and things like that. We build a community that is safe and supportive for the families. And also there are chat features where you can engage and ask medical questions. We're also working on a Q&A series to offer so that families can have kind of that more intimate inner circle engagement as well. And so all of those factors come into play as to what pushed me to build Parent Partners, because it was something that I saw again and again in my clinical practice where families are just at a loss. And these are hardworking families, even very high achieving families that just felt like the healthcare system as it was letting them down because they couldn't get access to the specialists that they needed in a timely manner. And then lo and behold, if you do get the appointment, the poor clinician has their schedule stacked and you might have 15 minutes with the visit. So it was kind of just like a losing situation. And so that's what's really pushed me to build Parent Partners so that this app feature, as long as you have your phone, you can connect with someone and really get the medical knowledge and feel empowered about your child's health education.
Thank you so much for sharing that, because I counted one time and we went to the hospital 132 times. And that was just over, 13 months.
Mm-hmm.
It that's without the specialist, that's without, all of the CT scans, MIBGs. So, just going, whether she was throwing up too much, bleeding too much, all of the above. And so it's so, so important to have programs like Parent Partners, because you really have a partner and it's so good. Luckily, we were, located in a highly populated area. And so there was a children's hospital available plus the ER. However, we know that a lot of people live in rural areas. Most people in America do not live in those cities. And so they do not have those resources. So thank you again for you're just going to hear a lot of thank yous because partners is just really what we need as far as like just getting the information to us, whether it be
Mhm.
literacy or what have you, to make sure that we are really, really getting our children what they need. So thank you again.
Thank you.
So you touched on a couple of other things. This was down my list, but we'll just go ahead and jump to it. As far as school and mental health, so I have a 6-year old, and she's already noticing like nuances of whether it be her being treated differently,
Mm.
whether or not it's because of her color. She's noticing color. She came home and asked, "Hey, mom, am I black?" And we had to have that conversation. And so it's so funny. You try to put yourself back into the place of childhood
Yeah.
as you were growing up, but things are so fast and our communities look different, right? We're no
Mhm.
longer on the same street where grandma, cousin, and everyone
Yeah.
is readily available. So seeing less of us or being the only is a very interesting tale of time of the times that we live in, right? And
Mhm.
so the fact that you guys also kind of cloak children and communities with that umbrella of mental health, and I saw that you had done a mental health chat with I forgot the name of it. I do apologize, but
PhD.
I think it's
Yeah.
so important. So tell us a little bit about the work with schools and
Mm.
in conjunction with mental health as we get into that.
Yes, so that is exactly what our back to school program focuses on. You're exactly right in that, apart from the home, kids are in school so many hours of the day, and their interactions there really build their outlook on life, for better or for worse. And that's why I wanted to build the back to school program because we talk about medical issues like, okay, how to mitigate flu season and deal with allergies, good hand hygiene, hand washing and things like that. But we also focus on that parent child interaction with the school system. So some of those things that we talk about are making sure that the parent or caregiver is from jump engaged with the school system. You want to be present for your child. You want to introduce yourself to the teachers. You want to introduce yourself to the principal because you want them to know that this child has a parental presence, someone who cares for them, someone who loves them, and someone who's looking out for them. So it doesn't have to be anything antagonistic, like, you showing up and say, like, you've got to treat my child in such and such way. But it's just showing that advocacy that is so important for in pediatrics around your child and putting the school on notice that you have a presence there and also being proactive about any issues. So many times I'll hear from families, and again, I hear tons in the ER, even though I'm not a school teacher, but I'll hear things like I have a kid come in with a physical altercation, and the mom's telling me about bullying issues, and things like that. And so, if you haven't been able to build rapport with the students, as well as the teachers and the principal, they are going to try to target certain kids and primarily children of color in certain ways. Unfortunately, this is just the reality of the world. So if you already have that rapport and they know that you're very involved, that you're engaged, they just honestly will approach things differently instead of perhaps one off expelling somebody, for example, if the child was being bullied. So that's the first thing I always say is that make your presence known in the child's life, but also at the school setting so that they have someone they can interface with if there are issues of bullying. And then also on the flip side, the silver lining is if their child's doing well, like I always tell there's some programs that I've worked with that's really nice where, they'll have the child called into the principal's office because they're doing so well. Like they were targeted for being good or very helpful. And then you make the phone call to the parents and they're elated because, 9 times out of 10, people have this onus of, Johnny's been sent to the principal's office. He probably did something bad, but it kind of flips that completely on its head to say, you want to highlight and give positive reinforcement for the child as well and reinforce that good behavior. The parental presence is super, super important. And then I think from there, you can build the rapport to make sure that any issues with mental health that does come up, you make sure that it's not reactionary, but proactive. So you notice Perhaps a child's getting more disconnected from schoolwork or not engaging with school friends as much. All of those things, depending on the age of the child and the temperament, mental health issues present in different ways. So if you are in tune with how your child is and have that connection with the school, you're going to be more equipped and empowered to make changes, to seek medical attention, therapists, counseling, things like that, to help get the child back on track instead of waiting, a whole semester. I've had poor families, they say, I had no idea my child was depressed, and now we're at the end of the school year. I don't have any resources for counseling. We have summer coming up. What do I do? And so it's really unfortunate because things like that can at least be mitigated. And it always starts with being present in your child's life in the school system and make your presence known that you're going to be an ally and advocate for your child.
Love that. And that is so, so true. And as a community, I just want to say on this platform that we have to advocate, even if it's not your child, if you see something, you have to advocate for other children as well. Like what you're hearing from the Matriarch Podcast? Guess what? There's more. So make sure you check it out on matriarchmom.com. We have a place for you to join our sisterhood and to be a part of something great. You would want the same thing done for your children, and I just want to put that out there. We are a village, whether you accept it or not. Your presence, whether you do, don't, or stay silent, still speaks volumes. And so I just want to state that and make sure that we are advocating for all children. Also, you talked a little bit about the mental health state and making sure that you guys are cloaking them and, with education and resources with parent partners. But I really want to take that a bridge farther and talk about our young boys. So within our Black Queen Circle, we've also talked about Black boys, the way that they're treated from a social perspective is very abrasive. Black is guilty and things of that nature. And then the fact that they are males, they are under attack even more. So that mental health and capacity for just helping them, where they're supposed to show so much strength at such a young age, we're asking these children to do too much too soon. What advice would you give from what you've seen, heard, or taught to parents with Black boys in particular?
This is such an important topic. And the simplest thing I can say, and I tell this to all of my friends and families and parents that I encounter, is that the first step is for the parents to engage in their own mental. A lot of these kids, they're brought up in a household where, and it is focusing on Black boys, emotional intelligence is not valued. So being in tune with your emotions, being able to verbalize and express and name how you feel is not highlighted sometimes. And again, I could go on and on about things that, for some people are triggers and other trauma. But if the parent or the caregiver is not fostering that from a very early age, I'm talking like late neonate to toddler, like very, very early, then the child is not going to internalize their own emotional well-being. And with that will come, they're not able to process. They will be targeted, as you said, typically in schools and, labeled as more aggressive and things like that, because they haven't been provided the tools at home sometimes to be able to verbalize and speak. If they're seeing people react physically to frustration and things like that, the kids are sponges. They internalize all of it, and that's what's reflected outside of the home. So I always say to families, because again, I know tons of us are walking around with this, you want to first address your own mental health and see like what issues and trauma you need to process. Perfect example, I'm somewhere in a park and I see family, mom and dad with, they had two boys with them, and they were probably like 4 and 8 or so. And the father's playing catch with one of the little boys, and the 8-year-old, for whatever reason, he gets upset. He starts crying. And the dad, loud enough for me to hear, I'm not even that close to them, keeps yelling at his son to say, stop crying like a sissy, stop crying, like again and again and again. So you can imagine what that does to this child. One, it's shut down your emotions, right? Two, you're being labeled as weak or less than because you are having emotions, and then the layer of sexism layered on as well. And so it's just like we first have to do better with ourselves to try to work through those issues as parents so that we're aware of our own triggers and trauma so that we can then start to try to not pass that on to the children. For kids specifically, once hopefully the parent is in a safe mental space, then you want to really focus on allowing the child to really just be themselves, not having those attributes of physically threatening or quote unquote strong, like you're not a man if you're not like that. You're not worthy of someone's respect or love or care. So many little kids, and especially little boys, they really are just looking for someone to listen to them, to hear them out about issues or concerns they're going through. Little boys feel anxious and nervous just like anyone else. They feel scared and worried just like anyone else. And that should be a safe space and welcome instead of saying, cut that out, shut that down, you're weak, you're, et cetera, all these derogatory things, because they internalize that and they process that often to their detriment. So I would say those are kind of, the first two steps where the parent has to be honest with themselves and reflect on their own emotional well-being and know what triggers and traumas they have to work through. And then always, and I mean this sincerely, at a very early age, start laying the groundwork where it's a safe emotional space for the child to express themselves, to verbalize how they're feeling, to really understand what they're feeling and why, as opposed to smashing that all down and compartmentalizing it and not processing it. Because you and I both know at some point it's going to come out. It can come out in a fight. It can come out in depression. It can come out in substance abuse. It's going to come out. And if you take this step back to say, I love my child, I don't want to make the same mistakes I perhaps lived through, etc. It's really, you owe it to yourself, but also to the child to do that mental health work.
Yes. Thank you. Thank you. Thank you for saying that. Dealing with our own traumas from a cultural lens. And I know I'm asking you to step out of the ER realm for a second and just join in our community. I go back and forth with this because I see things like that often, the example that you gave. And I really challenge millennial and now Gen Z parents to step outside of and look at what did you want or need as a child? What can you give your child as a gift that you did not have?
That's
That
so
is
true.
so important to our
Yeah.
growth in our community because what happens is if you're shut down, they're shut down. It's just a generational trauma that you're passing down to your children constantly. I made a decision as a child that that would stop with me. Obviously, I'm not perfect. I will fail in some way, shape, or form. Obviously, I won't know until my children are 25 plus and they feel, comfortable coming to me. But I'm constantly, how was your childhood? I ask them that. I've been
Yeah.
asking that since they were 2 and 4. That
That
is
is
so
so good.
important
Yeah.
because it gives me a check-in with them as a parent to say, okay, what is it that you need that I may not be providing? Or, hey mom, you yelled at me and it really hurt my feelings. And
Yep.
allowing them to say that, I know people are like 2 and 4, why are they saying that to you? It's important for me to know that, to know what the boundaries are, because my
Hmm.
tone of voice may be a yell to them, even though I'm not yelling.
Yeah.
And so having those conversations are so, so important. And it allows them to get their feelings out there, make them feel heard. And they are able to carry emotional intelligence and not just hide things.
Hmm.
And
Absolutely.
that's so thank you so much for saying that. So let's jump into TikTok. You mentioned it. I have to say
Uh,
it right. So we've got for millennials,
uh,
it was more so like Google. I always like to double check Google Scholar. That's just
yes.
based on my marketing background. But I will say, checking TikTok for information, please check the information.
Check the information.
Back to the pod, but Dr.
Yeah.
Arnold, I'll let you take it because I have just witnessed so
You and me both have witnessed too much.
much.
Yes. We're in an interesting time where There's so much information. It's available at our fingertips, but we're not able, unless you have specific training, to have guardrails on the quality of that information because you and I can post whatever we want, whenever we want, however we want, wherever we want. And there's no real vetting of the content. And so that's the double-edged sword that we have all of this information, but you have to know how to kind of really validate it and do a quality check. So that's where we come in, parent partners. There's a lot of content available, and our goal is to make the content digestible in kind of bite-sized format for someone who doesn't have medical training. I pride myself on being able to kind of interpret and translate for families as to what's going on, what are the issues, and what you can do about it. And so we have kind of multimedia where we have written content in the programming. We have articles available for the families on the app, as well as these short videos. We call them In a Minute with Dr. Alana, and kind of different formatting that allows the family or parent or caregiver to access the medical information in a way that they're going to understand it without having to sit down for an hour-long lecture about pathophysiology of something, because that's just not how people receive their information. And so we have our content is all evidence-based. We have some kind of tips and tricks and hacks for families because, again, anyone who is a caregiver or has a child of their own knows that it's quite demanding, it's quite challenging, and sometimes you feel like you're on an island. Being able to have a trusted medical source like parent partners allows you to be at ease when you have those questions. You have chat features where you can pitch questions and ask questions to us, and have office hours where we do more in-depth conversations for the parents and families. And then importantly, we're building these communities so that parents and families can connect with one another about their own journey for their child, be it medical or otherwise, just in terms of like a sounding board or a social support group for a newborn. You have a 3-day-old, you're sleep deprived, you're going to continue to be sleep deprived. And how do you mitigate that in terms of your own self-help and self-care and things like that? So we really are leveraging the internet and the information age that we live in to make sure that the content is of high quality, that is validated, and also easily and readily accessible because it's in app form, available 24/7 to the families.
Yes, I love that. Parent isolation is very
Mm,
real. I feel as though I went through that because my mom never showed, she was just a doer, right? She was like
mm,
workaholic. So the expectation I had as a mother was to just do it all. I
yep.
didn't account for the grandma that we stayed with. Well, both of our grandmas on either sides that we stayed with, I didn't account for. And so this superhero complex came into play that
Hmm.
I really had to deal with. But the fact that you bring up parent isolation, I think is a major, major bonus that you guys are talking to these parents because it's where you're the most vulnerable. You're trying to figure out what's going on with your body, what's going on with the kid, keep up with their poops, pees, and everything else. Um,
Oh my God.
their weight. Oh my
Change. Is this dangerous? Do I need to go to the ER? All those types of
God.
things.
Yes, and knowing that they're going to lose weight their first week,
Hmm.
all of those things matter. And just because things happen does not mean that you're a bad parent. And I feel like I want
Absolutely.
to say this to parents right now.
Yes.
If you are
Yes.
watching this, you are not a bad parent, okay?
Yeah.
You're just trying to figure it out like all the rest of us.
Absolutely.
Um,
It's a
and
process.
just knowing that that's available, I really, really could have used that because the guilt that came along with motherhood for me in particular was just that I wasn't doing it all. I was like, well, when am I supposed to sleep? Okay, I don't sleep. Okay, that's just a part of the job. Well, sleep
Yeah.
when the baby sleeps is what you hear, but then you're like looking at that pile of clothes over there and you're like, "Ooh, I don't know if I can sleep." So
Right.
I had a lot to deal with. And I just want to share like my personal story because hopefully it can help someone else. And just knowing that Parent Partners is out there to say, hey, it's okay is so, so beneficial. So thank you guys again. Last thing I want to tackle is Tylenol and Motrin. So now, even though we've had daughters that have had their own health issues, my other one had some hernia issues, broken leg, all of the things.
Keeping you
And
busy.
so knowing that you can give them Tylenol or Motrin prior to arriving, and I want to reiterate that because I was scared to do it. I was one of those, Dr.
You don't
Arnold.
want
Like
to know.
I'm
You don't
not
wanna-
not gonna lie. I was like, I don't want to give them anything because I want the symptoms to show, or I want them to take me more seriously. And
Yeah,
let's be honest, like there's a cultural component that comes into play with that, right? If
absolutely.
my child doesn't look sick and they're black, they are not. I experienced that for myself. So I'm sorry,
Yep.
honey, but you have to suffer because mom has experience, right? So
Yeah.
just
Yep.
talk to us a little bit about the Tylenol Motrin for one, and then just how that cultural experience expands into healthcare.
Yes, absolutely. So to address the medical thing, this is something we see very commonly in terms of child comes in with a fever. Because I have pediatric training, common things you're going to see. This depending on the age of the child, especially if it's like baby or toddler, but anybody like the kid's going to be pissed off because they have a fever. No one likes to have a fever. They're going to be upset. They're going to be pissed off. The second thing, they're going to be tachycardic. Their heart rate's going to be up. Third thing, most often they're just going to be more irritable and not cooperative with your clinical exam. So all of these features, lo and behold, make it harder for me to do my job. So I beg the families, please give the Tylenol or Motrin if your child has a fever. We will believe you. I always ask them to document like how you're taking the fever. Culturally, many families will just go by touch, which is not as accurate as you can imagine because my hand is not a built-in thermometer, and so listen, I gotta tell them this because we've all been there. Yeah, and I say, please have a thermometer in the home. Depending on the age of the child, you can take it different ways in the mouth, rectal for like neonates, for little babies, under the arm, etc. So I always say, have a thermometer at home, document what that temperature is. A fever is considered 100.4 or higher Fahrenheit. So you always want to document that and then treat the kid. So you can say, hey, Dr. Alana, at 3 p.m., I checked the temperature. It was 102. They were burning up. I gave some Motrin. Great, fantastic. We move on to the next thing. And so nobody wants to see the child suffering. I certainly don't. So please, please, please give them Motrin and Tylenol. Just make sure you always check the temperature first to see if they actually need it. So 100.4 or higher, and document how much you gave. As you guys well know, like typically on over-the-counter medications, they have it based on weight ranges and then age. Just to give a ballpark. A whole other topic would be childhood obesity in the US right now. So very often the child's underdosed, but just go by what's on the packaging and then we go from there as to what you need. The second component,
Sorry.
yes.
Before you move on, I just want to pause you really quickly and so that you can explain to parents why that does not intervene with the care that you will give them.
Yes. So the reason why treating a fever, for example, is not going to inhibit the care we're delivering is that, the signs and symptoms we're going to work out. We're going to work that out with the history you tell us. We're going to work that out with the physical. So if you tell me the child has a fever, we always err on the side of being conservative and we're going to believe the family because I have no reason not to believe you. And that helps us dictate the type of care. So if a family's coming in and saying, they've had a fever for the past 4 days, that helps me start thinking about differential diagnosis as to what could be going on, as opposed to you saying the fever just started this afternoon. So it's really important as best you can to document if the child is having fever and to what temperature, but that does not at all play a role in the type of medical management that we give. We wouldn't withhold anything if the child comes in without a fever, if you're reporting that the child has a fever.
Good to know. Thank you.
And the second component I just wanted to touch on, what you mentioned, is just how people of color interface and interact with the healthcare system. There is tons and tons and tons of literature that backs this up, that clinicians have implicit biases that play out in the care that they give. They surround race, socioeconomic status, sexism, ageism, even in certain areas, but certainly around race is a huge, big proponent of health disparities that a lot of millions and millions of people face when they seek medical care. Some of the things you spoke on are very, very common. So not trusting or believing someone's in pain is one of the bigger ones. Not trusting or listening to the symptoms someone is reporting is huge. And so when you have those types of things where the patient or the patient family feels ignored, they don't trust the caregiver or clinician that they're seeing, all of that is quite challenging and leads to these poor outcomes, these worst clinical outcomes for kids. And really, it's just very unfortunate because it's a work in progress in terms of cultural competency education. But the anecdote that I always tell families is that advocate as much as you can for your child. Don't let someone dismiss you. Don't let someone minimize what you're experiencing. And if, barring an actual, true emergency, someone's getting resuscitated, a medical emergency or trauma, if you really feel that the clinical care team is not listening to your concerns or issues, you always have the right to seek medical care somewhere else. I always kind of tidbits I recommend is that, if you're in an academic setting or a place where they have trainees, residents, fellows, things like that, you always can escalate to speak with the attending. That's the supervisor who everyone turns to in terms of like decision making. So I often will tell families, you always want to ask for the attending if you're at a facility that has trainees there. If that is not working, you can also, they call it different things, but you can always ask for like a patient care advocate or liaison or someone like that to get their information. Because even if you decide to leave the facility, you always want to make sure that you have a record or at least information to file a complaint if you think it's necessary. Because we never want to have a family feel like they weren't listened to or that their symptoms or issues were dismissed. And that's something that most hospitals take very seriously because it's a reputation issue. And so oftentimes you can get some more traction there if you get that information.
Love that. Wow. Love that. Love that. We are close to time, but before you go, we always like to get to know our sisters.
Yes.
We want to tap a little bit into your background. How did you come into being a doctor? Give us a little bit of your background, where you're from, and just give
Sure.
us a little story about how we can get to know you.
Yes, yes. So I am born and raised in Philly, and I think it was like early teenage years, I decided I wanted to go into medicine. I'm a pretty social person and always did well in school, always enjoyed school. So I was thinking of careers where I can still be pretty social, meet all types of people, and also do some good in the world. So for me, it made sense to want to go into medicine. I had a pretty linear approach, went to college and then directly into medical school and finished out my training. Thankfully, and I'm very blessed, especially in retrospect, that my medical training and my medical journey has brought me all around the country. So I did my medical training for med school in Boston and then went to Oakland, California for residency and then finished my fellowship in Houston. And I've now worked in so many different clinical settings, huge academic children's hospitals to more community to more suburban. And all of those pieces have allowed me to really curate and gain so much medical knowledge that's outside of the textbook, but also it's regional and really impacts how care is delivered. Things they're doing in Miami, they don't necessarily do in California. And so it really helps build my clinical acumen so that I feel comfortable in any setting. And even when the resources are not exactly the same, I always find a way to give the best care possible. So that's been really a blessing for me. And as you can tell, like I love kids. This is a passion of mine. And that's why we started Parent Partners to make sure that we're trying to bridge that gap in terms of healthcare for all children, but especially children of color who suffer from a lot of health disparities, and really giving that connection directly to the parent and family so that they can feel empowered and know more about what's going on with their child.
Love that. Love that. I would agree with you. We've moved to multiple states as well. And it's almost like culturally you can
Hmm.
identify, and your emotional intelligence grows along with that as well. So I just through my experience, I know yours has just been through the roof on just like, healthcare management and what's available,
Hmm.
what's not available, and how to make that work. It's almost like you're kind of out in the field, if you will, and treating your patients. So we definitely love that. Thank you. Thank you so much, Dr. Arnold, for joining us. for
Thank you.
enlightening us, for letting us know that it's okay to take Motrin and Tylenol.
Okay, please treat those fevers. Please treat them for the child's sake.
And thank you. This is not the last time. We know that we will be partnering. And so, those of you that are with us on Matriarch, you know what that's all about. We will continue to send out updates. And thank you very, very much for blessing us with your presence, your experience, and all of the above. So, thank you. Thank you so very much.
Thank you so much for having me. It's my pleasure. Please make sure you check us out. Our website is wellnesswits.com/parent partners. You can see all of our content there and subscribe. And then you can also check us out on Instagram at PEMPAL, PEMPAL_parents. We constantly have videos that we're putting out, and be on the lookout for some webinars coming soon as well.
Nice. Thank you. And we will make sure to send out those webinars. Just let me know what we need to send out, and we will do that for sure. Thank you so much.
Thank
Matriarch would like to thank you for listening to our podcast. Please visit matriarchmom.com to continue the conversation and join the sisterhood of other legendary Black queens in the making.